This is a real-time ultrasound view of the bladder. To orientate you, this is the feet coming down through here. Up here will be the head, and this is the stomach, the lower stomach. Here is the bladder through here, and this is the pubic bone through here. The wee tube, the urethra, will come down behind the pubic bone, and deep down through here, which we can't see on the real-time ultrasound, will be the pelvic floor muscles. What I'm going to show you now is the correct action of the pelvic floor muscles and how it moves the bladder in this direction up towards the belly button. I'll show you now the correct action of the pelvic floor muscles and how it moves the bladder up and towards the belly button. And letting go. And again, I'll show you the correct action of the pelvic floor muscles. And I'll hold 1, 2, 3, 4. I'll bring my pelvic floor muscles on a little bit more, and then I'll let my pelvic floor muscles go. What I'll show you now is the incorrect action of the pelvic floor muscles. This movement pattern many women do because they have a belief system that this is how they believe the pelvic floor muscles should contract. But this is what's happening on the bladder. I'll do it again. So they believe that they're contracting the pelvic floor muscles, but what they're doing is they're creating increased pressure within their abdominal area and pushing down on the pelvic floor. They can certainly feel something's happening on the pelvic floor, but what they're feeling is pushing their pelvic organs down onto the pelvic floor. I'll do it again. This movement pattern will not stop you leaking if you cough or sneeze. The movement pattern of the pelvic floor that will help you stop any urine leaking on coughing and sneezing, running, will be this action, where pelvic floor muscles have lifted and squeezed and moved the bladder towards the belly button and helped close the wee tube. I'll let them go now. Let me now show you what's referred to as the knack in the literature. Is that when you go to cough, the pelvic floor muscles will, just before the cough, lift, and then you will cough into a solid lifted pelvic floor. What happens when you cough and your pelvic floor muscles doesn't come on just before the cough in the way it should do in a reflex response? This is what will happen when you cough. The pelvic floor will move down more, the bladder will move down more, and you won't be getting that lovely closure around the wee tube, the urethra. I will now do the correct action of the neck, lifting and coughing, as opposed to and you can see that the bladder moves further down. Again, the correct action will be a lift and up, and there's a solid pelvic floor as it comes, as the muscles contract up and hold and it's like you're coughing into the pelvic floor where the muscles are lifted and holding, as opposed to when the pelvic floors don't respond just moments before the cough, and you'll get this action occurring. You can see how far the bladder is descending, and this of course can lead to leakage if that pelvic floor muscle is not coming on just that moment before the cough.